Numbers show a big jump in New Yorkers who are enrolling in health insurance plans, but it's a pretty even split between those signing up for Medicaid and those who are taking advantage of the private health exchanges. As our fact finders discovered today, it was a similar story years ago when Governor Mitt Romney rolled out a statewide health care overhaul in the Bay State. In fact, there are a lot of similarities between the so-called Romneycare and Obamacare. Pat Bailey's in the Albany newsroom to explain for us. Pat?
Yeah, that's right, Liz. Both similarities and a few glaring differences. Now, I talked with several people living in Massachusetts today, and they told me that their state is better off under Romneycare, and they believe, if given time, Obamacare could be just as successful nationwide.
I never could afford health insurance before Romneycare.
It's been 7 years since Mitt Romney unveiled a plan to get most, if not all, Massachusetts residents insured. Back in 2012, the Kaiser Family Foundation, a health policy research group, concluded after a 6-year study the percentage of uninsured people living in Massachusetts dropped from 11% to 6%, the lowest number in the nation.
I think it served a great purpose, supplying insurance for people that didn't have insurance.
Yeah, and I guess it works because the young people did sign up for it also, which is a key part of it. 7
years later, there are similarities to the Bay State's program and President Obama's. Both allowed for state-run exchanges. Both have subsidies for low-income households, and both have mandates on individuals and businesses. One expert says those Massachusetts mandates helped make Romneycare so successful.
So the penalties were much more substantial in Massachusetts versus the 1% or $95 for someone that doesn't participate.
And you're saying that made a difference in allowing more people in Massachusetts, or forcing more people in Massachusetts to sign up?
I think it encouraged more people in Massachusetts to sign up over the shorter term, yes.
Obamacare and Romneycare are not the same thing, however. For example, the size of the two, completely different. Massachusetts was dealing with just 11% of its population being uninsured, while at the same time, 18% of the rest of the country is uninsured. And the cost-sharing or preventative services are different. Obamacare says preventative screenings will come with no copay. Massachusetts says their insurers can carry one. At the end of the day, one expert says the differences are minimal.
Overall, though, I think there's more similarities than there are differences from a concept. There's nothing, structurally glaring that would make you say that, this is that different when it comes to sort of insurance speak.
Now, when talking about the success of the Massachusetts law, we have to take into consideration the goal. The same report I mentioned in the story there, the Kaiser family, said the goal was to get people insured, and it was not about costs. Although more are insured, the report states, and I quote, rising costs remain a serious problem, that in the state of Massachusetts. The vice president of Rose and Kiernan tells me that this is also the goal of the Affordable Health Care Act, getting people insured, not low cost. However, he did tell me New York has considerably lower exchange rates than other states. In the Albany newsroom tonight, Pat Bailey, CBS 6 News.